Hey, good evening. This is Dr. Sullivan with I Care for Your Brain. We are here every Wednesday at 6 o'clock with free high-quality brain health information. Today we're going to continue our discussion about mental imagery and stroke recovery. And this is rule number 4 in our book, The Stroke Recovery Guide. What we did was we distilled the top 10 rules of rehab into the book. It's kind of the heart of the recovery guide. And the reason we did this is because there is an incredibly high level of unmet need in the stroke recovery community. 80% of people who have had a stroke talk about one or more significant unmet needs. And the top 2 areas that come up over and over again, and I see it in my patients all the time, is education and support. So as people go through the stroke recovery medical system, people have very high satisfaction ratings with places like stroke centers, inpatient rehab centers, and even outpatient rehab therapies. The problem is how these scores of satisfaction drop dramatically once people return home. People have often told me it's like getting dropped off of a cliff. I didn't know what to do. I wasn't sure how to design my day to get the best rehab. I didn't really know exactly where to put my energies. I had all sorts of confusion happening. I was starting to feel very overwhelmed. Many people can get depressed. And part of that is preventable if we would just provide people with a guide on how to move forward. So that was what was really in our hearts when we designed the Stroke Recovery Guide. So tonight what we're going to do is go over rule number 4. We talked a little bit about it last time, and it is how to harness your creative power, your creative mind, your creative energy to bring spontaneity and fun and novelty and life rehabilitation so it does not become a chore. And the reason this is so important is because it really matters and it influences that beautiful word that you're all looking for, that neuroplasticity, how to actually rebuild and strengthen connections between a damaged part of the brain and a healthy part of the brain. You always want to remember a stroke is a focal brain injury. Your whole brain was not affected. You've got the whole rest of your brain to compensate, but you need to know what to do. So remember, it is really a cruel myth that stroke recovery only happens for a very short amount of time. And a lot of us think, who are interested in more progressive stroke care, that idea of a year of recovery at max is really based on what the insurance companies are willing to reimburse for. And that is not good enough for you. That's not good enough for your loved one. So I really wanted to put a recovery guide, a map out there, so that way nothing could stop you. You would know exactly what it is you needed to do to reach your maximum recovery. So remember, recovery from a stroke really is a lifelong process. You can restart it at any time. The idea is you kind of get more bang for your buck within those first 1 to 2 years, but the truth is it really never ends, and you can return to stroke recovery at any time. The more you put into it, the more you're going to get out of it. But again, my concern was no one was really directing you and telling you exactly where to go. So what we know truly affects the extent of the recovery you can make is your post-stroke care. So any of you listening who have had a stroke, I would love for you to rate what you consider your post-stroke care to be. And what I mean by this is actually after the official rehabs have stopped. So after you stop PT, after you stopped occupational, after you stopped speech therapy, how do you feel you were guided? And I'm going to imagine many of you are going to give very low scores, and it's because it's true. There is not nearly enough long-term support of the stroke community. So let's get back to rule number 4. So like I said, this is really using the power of your mind to help heal your brain. And that is a very important distinction that we always want to make in brain injury, is that for so many people, the mind is left completely intact. Even if there are some changes in your processing speed, in your short-term memory, even in things like aphasia, there is still the you that is in there, the you that is able to be creative and use mental imagery and use your imagination to impact the success of your overall rehab. And this is even more key for those of you who have fallen into those unfortunate patterns of feeling like your recovery has become medicalized, where you go to the doctor a lot, you don't really approach rehab therapies with a sense of joy. There's a sense of duty and almost drudgery. And believe me, I really don't know, like those of you who have had a stroke know how hard it is, how difficult it is, how painful it can be emotionally and physically. But this creative approach to rehab actually allows us to try to bring more of the spontaneous human spirit, which is a very healing energy neurochemically and just psychologically, into your rehabilitation. So this is luckily a new trend that we're starting to see in rehab programs, that people are making rehab more fun, more personalized, more joyful. And so now we actually consider a creative approach to rehab an evidence-based treatment. So there have been research papers that have been put out really since about 2010. So we're going on 10 years now, where we know that people's cognition improves more when they are invested creatively in their rehab. People's physical impairments get better in the long haul. We absolutely know it helps with things like self-confidence, anxiety, quality of life, relieves depression for many people, gives us a sense of control, which can reduce anxiety. Things like blood pressure actually go down when people are engaged in a creative activity. So as you start to think about this topic more and more, I want you to think about, this is really the chance to validate that this is not just a physical recovery journey. It's not just a brain injury recovery journey, but this is also an emotional recovery journey, a spiritual recovery journey, psychological recovery. So when we do these creative activities, it really allows us that sense of playfulness, of spontaneity. There's a spark there, a life force that all too often is drained from traditional approaches to stroke recovery and rehab. The key is really finding something that appeals to you. What's creative for one person might not necessarily do it for the other person, but all creative activities have their own brain advantage, really based on these 4 principles. The first one is that creative action is unique. The brain really thrives on novelty. The brain will focus and pay its best attention to something that is new. That's just something that has been built in us throughout evolution. There's people that have made their entire research careers based on how we orient towards novel things in our environment. So use that to your advantage and do things that are unexpected. If you're always doing the same rehab program over and over, there's part of the brain that kind of tunes out. It doesn't bring that same amount of focus and brain cells to focus on that one activity. So you want to bring in things that have a unique, unexpected element. Next one is that when we are creative and we are in that zone, you know, that zone where you kind of forget the time and you're just, it's almost like people say time takes on a different quality. Maybe an hour has passed, maybe it's only been 5 minutes. This feeling is related to the chemical environment in your brain. So we know that things like serotonin are being released and stress hormones are going down and adrenaline is going down, cortisol is going down. All the things you want to go up to heal brain cells is going up, and all the things you want to go down that are not very friendly to the regeneration of brain cells are going further and further away from you. That is exactly the type of environment you want and need in your brain. The third one is being creative really improves your problem-solving skills. You start to think in a way that's not necessarily linear. You're not going from 1 to 2 to 3, A to B to C. You're actually starting to approach things with a little bit more of that right brain involvement, which is seeing things in a more holistic, kind of unique way. There's more possibilities when we think creatively. And the last one is very psychological. This is a feeling of control and in mastery. One of the greatest losses that can happen after a stroke is that feeling of not necessarily being in control in the way that you were before. Not in control of your body, not in control of your mood. And being creative, there's less rules, right? Anything goes. We're allowed to make something messy. We're allowed to yell. We're allowed to be emotional. We're allowed to jump up and down. You're really able to express yourself and let things out and feel good about what it is. Perfection and creativity don't really go together, do they? So we have different expectations of ourselves when we're allowing ourselves to be creative. So in the world of mental imagery and stroke recovery, there's really one intervention that is of the utmost importance, and we've actually done a lecture just on this alone because it's that important, and it is mirror box therapy. Some of you have done this. Some of you have written to me to let me know how helpful it's been to you, and I wanted to spend some time just going over it tonight, but someone recently sent me a direct message here on Facebook and said, could you just go over some of the exercises, because I have one, but I don't know what to do with it. So let's just start off by saying it has a very strong research specifically for pain related to stroke, related to spasticity, related to amputation, but also hemiparesis, when your hand or your arm or your foot or your leg is paralyzed to some degree, does not have the same strength, does not have the same coordination, doesn't have the same openness of movement that it did before. So we know it can improve dexterity, range of motion, speed, and grasp, all the important things that your hand specifically can do. And what's so cool about mirror box therapy is that the benefits go beyond just the moments that you're doing the therapy. So when we see that expansion into everyday life, that impact into your real world, that's when we know that real neurological change has actually happened, because it transfers. You're able to see a benefit in your everyday life. So it works with a little bit of magic, which is part of why I think I like it. It just is kind of an interesting, creative idea. But you're really banking on a visual illusion. You are giving your brain the incorrect but positive message that that affected limb is moving effortlessly. So you're really thinking about the visual feedback that your brain is getting in the mirror box. And so for those of you who don't know what this is, we're going to actually post a link to one that we've worked with the company, and it's a really wonderful guy who runs it, and he offered us a discount. So if you click on this link and you want to get it, I think they're around $50. Basically, it's a box, has a mirror in it, and the whole idea is you put your good hand, say, on the right side, and the mirror is right here, and you put your not so good hand on the other side, and your brain actually isn't seeing the bad hand. It's kind of covered up, right? So what you're doing the whole time is just using your eyes to look in the mirror, and then the exercises happen with your good hand. And the idea is that your brain is getting a message. What it's seeing is a left hand and a right hand working, being effortless in its movement, picking up things, and it's fooling the brain into thinking, oh my God, my hand is back. When your brain gets that kind of visual information, it has to make accommodations in the brain in order to perceive that, to understand that that is actually happening in front of it. So your brain actually thinks that you are moving the impaired hand. And when that happens over time, you're actually rebuilding the neural networks, because your brain has to find a way to make sense of it. So the network is working hard to connect the limb and the brain's map inside your mind that is telling you that you have had this hand that has been injured by the stroke. So the examples that people were asking for, believe it or not, are just so simple and straightforward. I have not seen an established protocol telling me what specific things are most helpful. I did look at someone from a rehab hospital who said they're working on a research protocol to actually be able to show with research what exactly you should do. But basically what I found is it's really about basic movements and feedback. So some of the things I've seen on YouTube and talking to other people is just simple things like this, just sitting there for 10 minutes and just moving your every single finger to touch your thumb. Things like just clenching and unclenching your hand. And remember, you're not watching your hand, you're looking at the mirror, so you see two images of the same hand, two good hands working. I've seen people do things like pick up objects, so you can have a paper clip there, you can have a cup there, you can have a pencil there, and you're just simply picking it up and putting it back down. Now, what you want to try to do is basically have your hand that's not working so well mimic the good hand as much as you can. So that not so good hand is not necessarily just being passive and sitting there behind the black box. You're actually trying, if you're moving your hand like this, you're actually trying as hard as you can. Even if you can only open that hand that's clenched a tiny bit, just try as best you can to get it to mimic the good hand, okay? anything that your good hand can do that your not so good hand can do is the exercise. Like I said, it's very simple stuff. There's not any magic formula. You don't have to pay anyone to tell you exactly what to do. You're just simply trying to get more flexibility, more coordination, more speed. So you could have a little pegboard and you could put things in a peg. You could have like a stress ball and just sit there for 10 minutes a day over and over again, just squeezing the ball. It's really about the rehearsal and that visual feedback loop that is basically tricking your brain. So I would love to hear if any of you have experience with Mirror Box. Please chime in, and that way you can let some of the other people watching and listening know if it's worthwhile for them. So what we talked about last time was mental imagery, and this isn't definitely in my top 5 things people who've had a stroke need to know about, because it's free, it's low risk, it's something you can do within your own mind, and it really works. It is evidence-based. So here's what is so cool about mental imagery. When you are imagining yourself doing something like a physical movement, we know that the same areas of the brain that would be required to do it in real life are activated in very, very similar ways. So let's just say, ever since your stroke, you are unable to use your left hand, your left arm very well. As you are imagining yourself in your mind's eye using that hand, throwing a baseball with that hand, drinking a glass with that hand, getting dressed with that hand, your brain is actually having to fire and release chemicals and try to make connections in order to actually do that. So it's free therapy. It is something that you can exploit for your own rehabilitation. But what you have to do is make it a habit. And you have to really, really, really give it your all in terms of your imagination. And so that's really why we are here tonight, is to really walk through an exercise with everyone that you can do at home, totally free. I'm going to actually give you a link when I'm done to a PDF that's basically a free 2-page handout of how to actually do this in your everyday life. So last time I talked to you about 2 different types of mental imagery. So one is called external, and this is where you imagine yourself doing something, but you imagine what you would see as if you were an observer, right? So kind of a third person. Or an internal technique where you actually imagine yourself doing it and think about what it would be like in your own body to do that action. That is what I want you to do tonight as we go through these exercises. So the first thing you have to do is pick a symptom that you want to work on. Okay, so one of the things we talk about in the I Care for Your Brain Stroke Recovery Guide is that this is such an important first step, that if you don't have all of your symptoms articulated, it's like you don't have a map. So what do I mean by this? I mean that your stroke symptoms are not just what people can see. They're not just the things that your doctors have identified. They're not just the things that you have had treatment for. This is the full gamut of your world post-stroke. So of course there are sensory deficits. So these are things like vision issues, things like pins and needles, losing your sense of smell for some people. The physical, right? That's overemphasized in stroke care. Cognitive, okay? There's a lot of focus on that too. Memory, aphasia, slow processing speed. But there's also 4 to 5 other things that are just as valid and just as common, but just don't get a lot of airtime. These are mood changes, behavior changes, social changes, intimacy changes, and financial changes. So whatever one of those symptoms you have been struggling with, I want you to focus on one of them right now. So you can go inside your domain. Let's just imagine, I'm going to say I have had a stroke and I have some trouble with speaking, and it has definitely hit my confidence, and it makes me feel like I don't want to talk in front of people. And it just makes me feel dumb, and I feel like people are judging me when I try to talk, okay? None of that sounds very good at all. So I am going to imagine that that's my focus as I go into this exercise, okay? So remember, I'm gonna walk you through this right now, but when I'm done, you're gonna be able to click on a link and get, I think it's a 2-page handout where all this is written down for you, so you don't have to worry about writing it down right now. The first thing as you go into an imagery exercise is you actually have to get your nervous system to calm down. You can't approach this necessarily at first in the line at the grocery store. This is something you want to do in a relaxed, quiet environment where you're not going to be disturbed. You're at least going to have 10 to 15 minutes to really be able to lose yourself in your thoughts, okay? The quickest and most efficient way we know to calm the nervous system is with deep breathing, right? So the first thing you're going to try to do is to pull in your breath all the way down to your belly for 10 seconds. You try to hold on to it for 5 to 10 seconds, and then you blow it out really hard for another 5 to 10 seconds. The holding piece is the step that I often find people are not doing. They're just breathing in really quick and then breathing out. You want to actually hold on to that oxygen for as long as you can and then really emphasize the exhale. The exhale is where we get rid of the carbon dioxide and all that crap we don't want anymore. And that's part of what really brings down the nervous system and helps us to relax. You want to be in a feel-good state of mind when you start to do this exercise. So let's imagine that you've done that, you're in a relaxed state of mind. Then I want you to move into positive affirmation time. This is where you're setting the stage for a positive mental imagery session. So you're going to start to think positively about your recovery and say things to yourself like, I am recovering more and more every day. The more I put into my healing, the more I am going to get out of it. My brain is healing, and I will use the power of my mind to visualize a successful recovery. You want to get into a expectant, positive mindset. So you're just kind of verbal in your mind first, right? Really setting the stage that I can do this. I am powerful. I am in charge of my recovery. Okay. Now you're really going to sink into the imagery. The whole idea here is to, as effortlessly as possible, imagine yourself doing the thing that is now difficult for you because of your stroke. You're going to see those images in your mind. So let's imagine I am having trouble speaking, like I said, and I've become kind of a little bit meek and I'm not feeling very confident. So I am going to visualize, to imagine myself speaking, let's just say at a wedding, and I'm going to see myself. I'm going to imagine the words coming out of my mouth flawlessly. I'm going to imagine myself having eye contact with people and just feeling totally confident. I'm going to imagine what the lighting is like. I'm going to imagine the glass of champagne I have in my hand. I'm going to visualize people looking back at me, smiling, nodding, knowing that I'm making sense and that they're understanding the message that I'm trying to communicate. The goal is to try to make this image as vivid as possible and to bring in as many of your senses as possible. So remember, the idea is that this can be applied to any symptom whatsoever. I mean, all the way from the medical bills piling sky high and imagining yourself, being able to write a check and pay those off and how that would feel to have the stress of that reduced. Imagining, yourself being able to walk with a very wide stride and being able to be very fluent in the way your body is moving through space. You want to really bring in the physical, the cognitive, and the emotional. Those are your three major components. So what I want you to do is try to start doing this twice a day, 10 to 15 minutes a day. And actually in the handout we're going to give you, we actually have action steps, what we like to call an interactive, so you can put all of our important lessons into play. So you're going to just try to do this for 7 days, and at the end of that, I just want you to think back on how that has helped you. For some people, when they do this, they actually get kind of emotional because they haven't allowed themselves to relax into the symptoms and think about what it would be like to not be held back by them, to allow that creative space in your thinking, to remember that feeling of not having impairments and the steep slope of life being like this. It's very important to allow yourself that time to break away from a stroke identity to really get back into your own personal and spiritual identity. Those are two things that are just absolutely critical. So I would love for you guys to do that. Please check into the PDF when I'm done in a few minutes and print this out and bring it into your everyday life and just see how things start to change. It's such a respite. This is essentially what meditation is, and you know how much research support there is for that, for all sorts of things that we struggle with as human beings. But more and more, we're definitely starting to see a creative approach to rehab therapies. It's just so important, and I've said this before, to bring yourself into your recovery. Recovery is not a cookie cutter game. My brain is uniquely built around my hobbies, my life experiences, my relationships, my personality. And if I don't map my recovery onto that, then I'm going to be missing the boat and not get as well as I possibly could, because I'm not really taking the full benefit of my unique brain. So please don't accept cookie cutter care. Sometimes you have to reinvent the wheel yourself, and the people around you have to try to do that. I see so many inspiring stories on Instagram and on Facebook of people just really being incredibly creative. So I would like you to really try to take this message to heart and let me know how it works for you. I will be back again next Wednesday at 6 o'clock. I don't have a topic as of right now, so why don't you write me? And you see, that's basically how we got here tonight, is somebody sent me a little message and said, hey, can you go over Mirror Box a little bit more? And here we are. So please do that. I will see you guys again real soon. And Stroke Recovery Guide, it's on our website, www.icfyb.com, icareforyourbrain.com/guide. And we'll see you next time. Take care, you guys. Bye-bye.